Turn the furnace off. All right, blood clots. What's going on, Secoya Nation? Dr. Schilling bringing you today's wellness wisdom. And this is a hot topic for a lot of people. Anybody who's had the Rona in the past or had issues with breathing before, sometimes they feel afraid of blood clots or it's a misunderstood concept. So today we're going to talk about them. So this one was inspired by a friend of a participant who has been struggling with them and not getting necessarily answers they need or want. And as a result, they're feeling confused and self-doubt and they're not sure what to do about it. So the blood clot is a physical manifestation. There's no denial that it actually exists. We're talking about the brain-body connection as to why they develop. From an electromagnetic standpoint, PEMF is really good for decreasing blood clots because when red blood cells lose their charge, they can start stacking on each other because they lose their positive and negative charges, and they can start stacking called rouleau, and that can lead to blood clotting. But generally speaking, when you think about blood clots, people think of like thrombosis in the lower leg, clots in the lungs, clots in the brain, stuff like that. So we want to appreciate Kari's friend who inspired us with this. And so, we're just going to go with it today. There's different aspects of it related to whether it's family or whether it's life and things like that. So in a general sense, when people have blood clots, it can be triggered by someone withholding love from them. They might withhold love from themselves and things like that nature. As a result, they might develop that blood coagulation, if you will. Certainly, of course, if there's injuries, that's also a potential, cause to potentially bring on a blood clot. But when you think about the family, think about things related to where people are not being seen by their family, or they feel like their family's putting conditions on them. For parents, it could be that they're not feeling seen by their kids, and for kids, it could feel like they're not being seen by their parents. Those are some general threads. Some people feel like their families are barriers to their progress or their fulfillment in life. Like when they put sort of conditions on them by saying like, they don't say like I'll punish you physically, but they'll say I won't talk to you if you do this. Like for example, during COVID, think about the people who you can't see my kids unless you get vaccinated. They sell that to the grandparents, or they'll say if you don't. If you're not vaccinated, you can't be part of our group, you can't be part of our church group, you can't be part of our club, if you will. So those are obstructions to people being involved in people's lives. And so when you put conditions on love, that can affect the red blood cells. We encourage you to share this with your friends and family because this is information you're not going to get anywhere else. This is not information that I own. I did not create this, not come up with this. This is what the literature shows as far as German new medicine resources for understanding blood clots and the brain-body connection with them. So if you're feeling unforgiven by your family, if you're feeling like in order to be forgiven, in order to be loved, once again, they put conditions on you, that's another big trigger. Remember, we're looking for the trigger incidents, the trigger situations, the trigger relationship stresses and stuff like that, so that if there's like a feeling of danger in a relationship, like I feel in danger of losing someone because there's so many conditions, that can trigger a blood clot. And sometimes there's self-evaluations, or like someone may learn something about their family member and then there's like dirty blood, if you will, like there's impurities in the blood. So that can trigger a brain-body disconnect where the body develops the clot as a result of understanding that conflict. And just to give you a frame of reference, like Dr. Hammer, who developed German new medicine, he developed testicular cancer immediately after his son was killed unexpectedly and tragically. And so Dr. Hammer was like, how does this work? Like, my son died, I got testicular cancer, so testicles are about loss in your life or loss of love. And same with the ovaries, loss in your life, loss of love. So Dr. Hammer determined there's this big trigger. I then developed a condition. They must be somehow related because I had no issues with my testicles before my son died. And all of a sudden, bango. Just like with women, like nest worries and fear and worries and strife, they can develop breast cancer after an immediate stress within the nest or in terms of their strife, like bitter disagreements over fundamental issues. As a result, sometimes even like when people can't acquire the territory they want, can't assert themselves in their territory how they want to, that can create blood clots as well. So That is the brain-body connection with the blood clots and how you might consider this, like overlaying it in your life and saying, how is this relevant to my, like if I have blood clots or some of my family members or my loved ones have, friends have blood clots, what is that, how is it related to? So listen back to these and understand there's a discussion to be had here with the people you love and say, well, did any of these resonate with you? Send it to them. Send it to your friends and family. Like, there's going to be some people who are going to be like, oh my gosh. If they're really honest with themselves and they take a look back, like what preceded the blood clot. Some people's memories aren't as good as others, so they might need the help of someone else to remind them. But just talk to your family members, your friends, your loved ones, and ask them, like, how is this relevant to what preceded your blood clot? Because in the absence of a trauma, the body breaks down on the inside before the outside. And as a result, if there is not a trauma to the body, then there's no reason the blood should coagulate and clot. That's just plain simple. This is not medical advice. This is just meant to be an understanding of your brain-body connection, as always. So if you have a topic you want us to talk about, please comment below. Share with us your ideas. Let us know what you want us to talk about, what's important to you, what will help you change your life, how can you feel more connected to your body and connected to your world. And we look forward to serving you with that. Appreciate you. Love you. We'll see you later. Bye-bye.
117.